Hi, my name's Kyle. I have bladder cancer. This is the second video in a series of videos where I discuss my experience with bladder cancer and treatment. So if you've watched the first video, then welcome back. And if you haven't, then I recommend that you go back and watch the first video. The first video talked about some background about bladder cancer and about me, and how I learned that I had a problem that turned out to be bladder cancer. This video discusses the biopsy that told me for sure that I have bladder cancer. I'll warn you up front, this video contains some graphic, unpleasant and gross and embarrassing situations involving my penis. So there's that. So after my urologist saw in the CT scan and in the cystoscopy that I have a tumor on the wall of my bladder, he scheduled me for surgery to biopsy that tumor. A biopsy in your bladder is called a TURB. A TURB biopsy. So TURB is TURB. TURB is Trans-Urethral Resection of Bladder. So that is a bit similar to a cystoscopy. A cystoscopy where they use a flexible scope to look inside of your bladder. A TURB uses a rigid scope. It's rigid so that they can insert tools into the bladder, and they can't do that through a flexible scope. So it's a rigid scope that goes through your urethra into your bladder. They insert tools that allows them to slice off pieces of the bladder lining and pieces of the tumor with a hot knife. So it's an electric loop of wire that can slice off pieces of tissue and at the same time cauterizes the tissue to prevent it from bleeding excessively. And they also have a tool where they can kind of pinch and twist off pieces of tissue. It's an outpatient procedure. It's done under general anesthesia. I was asleep, thank goodness. So I don't know exactly how long it took, but I think it was probably, I think I was in and out in under 4 hours. So in my TURB, I can tell you what happened. It was done in a surgery center, which happened to be in the same building as my urologist. So I arrived, and they took me to a prep room with a hospital bed or a gurney and a TV, and I behind a curtain. I changed into my gown, and they gave me an IV, and they gave me a pill. I'm not sure what the pill was. It was either starting me on antibiotics or maybe I don't know what it was. I didn't ask. I waited for about an hour in that room with my wife, and then they took me back to the operating room. And there was music playing, and because they were listening to I think classic rock. And they had me move myself from the gurney to the operating table, and they had me put my butt into this hole in the table. That's where they wanted me placed. And the anesthesiologist put the drugs in my IV, and I felt really weird. I felt like when you take your car to the mechanic, I felt like I was the car, because they were listening to music and they were talking amongst themselves, and I was just the thing to be worked on. So that was a weird feeling. I never had surgery before, so that was it's the first time. So I started to get really nervous, and the last thing I remember saying was, I'm freaking out here, and then, unconscious. When I woke up, I was in the same prep room with my wife, and I was in some pretty significant pain. I don't remember much about it, but I do remember saying I was in pain, and my wife said I was in pain. So they put some more drugs in my IV, and they might have given me a pill for pain. That I don't think that pain lasted very long after I woke up. Maybe just a few minutes. So I didn't know it until later, but at the time when I woke up, I was hooked up to an irrigation machine. I had a catheter, and the machine was hooked up to my catheter, and it was forcing saline into my bladder, and then either sucking it out or letting it drain out. So that was kind of flushing the insides of my bladder with fluid I think probably to flush out any blood or clots or any kind of materials that were in my bladder before they sent me home. So they waited until I was stable and my pain was managed, and they waited until the urine that was coming out of me, or the solution that they were flushing my bladder with, they waited until that was not bloody anymore, and they sent me home with hydrocodone for pain and Bactrim antibiotic to prevent infection. So I mentioned that I had a catheter. It's an indwelling Foley catheter. That is a tube through your urethra into your bladder. This is the tube. The tube goes into your urethra, into your bladder, and then there's like a little balloon at the end that they blow up. I think probably with saline. That keeps the tube from ripping out of your bladder. So it's kind of anchored into your bladder. And that balloon, I think probably makes a little bit of a seal that prevents fluid from your bladder leaking out around the catheter. So it's anchored in your bladder with this balloon, and then after it exits your urethra, it's anchored to your thigh. There's a big patch of sticky tape on your thigh, and then a little plastic clip on the sticky tape that holds the tubing of the catheter. So that prevents, like, if you snag your catheter tube on something, it prevents it from pulling and possibly being dislodged from your bladder, and it prevents a lot of discomfort. If you happen to drop your night bag or whatever, the weight doesn't pull on you. It pulls in your thigh, so it's a lot less painful, I think. So I had all that already in when I woke up from the procedure. They sent me home with a leg bag. So they'll send you home with two bags. You get a night bag, which is a large bag, I think, if I remember right, it was over 1,000 cc's, so about 1 liter of fluid. That's a good amount. So that's the night bag. It's a big bag. It's maybe it's about as big as my head, I guess. And then they also send you home with a leg bag it's a very small bag. I forget how small it is. It's a lot smaller than the night bag, and that attaches to your thigh with, at least mine attached with 2 Velcro straps. So they hooked me up to that leg bag and strapped it on my thigh and sent me home. So when I got home, I immediately replaced the leg bag with a night bag because I didn't want to have to change out the leg bag a lot. So I hooked up the night bag and sat down on my lazy boy and just put the night bag on the floor next to me. I either had it in a bucket, or we actually got a turkey roasting like aluminum pan that we kind of laid the bag in. We threw it away afterwards. We didn't try to reuse it. So I sat in that lazy boy, and that's pretty much where I was for a few days. And I slept in there too. Looking back, I probably could have slept in my bed, but I was afraid that I might roll over and pull on the tubing, and it's kind of uncomfortable when you pull on it. And I was kind of freaked out by it, so I didn't know what to expect if I pulled it on too hard. So I ended up sleeping in the chair because I was a lot less likely to roll over when sleeping in a lazy boy. So I was just sleeping on my back the entire time. And the lazy boy worked out really well. We kind of propped it up so that the tubing, propped up the chair so that the tubing could, the urine could drain better into the bag on the floor. That probably wasn't necessary. But we had that flexibility of being able to kind of manipulate the chair. It's a lot harder to manipulate a bed. So one of the most mentally difficult things about having that catheter was my son's reaction to it. I've got a 4-year-old son, and of course I never showed him the penis side of the catheter, but he saw the bag side, and he saw that I was peeing what looked like blood. I mean, he knew I was peeing into the bag. We had to tell him why the bag was there, and it looked like blood. And he was really scared of that. In fact, at the beginning, he refused to come near me. And I get it. I was scared of it too. But that was hard. So I didn't know what to expect going into the procedure, and I didn't know what to expect when I came out of the procedure. But looking back, I probably would have warned him that was going to happen and kind of prepared him for it, because he was freaked out. And I actually ended up covering up the bag with a towel, so he didn't see it. He could see the tube, but he didn't see the collection of what looked like blood in a bag, and that made him a little bit more at ease. Yeah, it was rough when he was scared of me. I also had so that was mentally difficult. I also had some physical difficulties with the catheter. I was told to drink a lot of water to flush things out and keep the fluid moving. Keep fluid flowing through the bladder, and prevent blockages if I was clotting, and flush those clots out. So I was drinking a lot. I was drinking a lot of water. In fact, I still drink a lot of water now. Since I started having these issues, I've been drinking a lot of water, and that's exactly what you should do. So that's a lesson. Drink water. So even though I was drinking a lot of water, my urine was very bloody, and doctors will tell you that just a little bit of blood in your urine makes it look really bloody. But mine was really, really bloody. I've since read somewhere that if your urine looks like cranberry juice, it's okay. If it looks like tomato juice, it's not okay. The first time I had a big issue, I woke up in the morning and I noticed that my bag, my night bag, didn't have very much fluid in it at all, and I'd been drinking during the night whenever I woke up. So it should have had some urine in it, and it didn't have very much. So, and what was in there looked like pure blood. It looked like tomato juice. So I just started drinking water just to flush out whatever was wrong, and to get my urine back to a better color. And nothing was coming out, even though I was drinking. So I got up out of my chair and I was walking around, just to get moving, maybe flush some things out. And still, nothing was coming out. So I kept drinking, I kept walking, I kept moving. And then over the course of the day, it just didn't get any better. And in fact, I don't think anything else came into the bag. So of course I got pretty worried. I called my urologist, triage nurse, and I got a voicemail. I left a message and I waited about an hour, I think. Got no response. So I called the surgery scheduler, the other number on my urologist business card. I got a voicemail, I left a message and waited for a bit, got no response. So I called the emergency line, even though their office was open. My surgery was on a Thursday and this was a Friday. And the emergency line said, well, the office is open. I can try to get in touch with them, but I think you can get in touch faster than I can. So I called the triage again, and I got a voicemail, and finally I got fed up and I called the line that you call to make an appointment, because I knew I would get a person. And I frantically told them the issue, and they got me in touch with the triage nurse, within a few minutes. And she said, I told her the problem, that I wasn't passing any urine and what was in my bag. It had been 12 hours, I think, since I passed any kind of urine, and what was in the bag looked like just straight blood. And she must have missed that part, because she said, oh, you need to go to the ER and they're going to have to put a catheter in. And I said, I already have a catheter. And she said, you need to go to the ER now. And she actually called ahead for me, asked me what ER I would go to, and called ahead for me to let them know that I was coming. So so I went to the ER in my underwear and a robe, because I was in no shape to get dressed. And by this time, I had been drinking water like crazy, and my belly was totally distended. I was in a lot of pain because my bladder, which had just gone through a procedure, was totally stretched out. I was actually shaking with pain. And that catheter was in there to avoid this very problem. They don't want your bladder to get distended, because it breaks the blood clots, the clotting, and start bleeding again. So I was in a bad situation. So luckily the ER got me right in, and the doctor, when I saw the doctor, the first thing he said was, "Whoa, why'd you wait so long? You should have come in sooner." Yeah, thanks, bro. I just didn't know what to expect. So now I know. So the nurses tried to irrigate the catheter. They were so irrigating is there's a little port on the catheter where you can insert a large syringe, and they fill that syringe with saline, about 60 milliliters of saline. And they pinch the tube, the catheter tube, so that it can't go to the bag, and then they force that saline into the tube, and that pushes the saline into you and into your bladder, and then hopefully, if things are going well, it just immediately drains back out, because that's what the catheter does. It just drains. So they tried 3 times to irrigate, and every time they pushed saline in, it didn't, it wasn't dislodging anything, and it just made me hurt, because I think the tube was expanding, and I was already in tons of pain. I was laying in the bed shaking. One of the poor nurses couldn't get an IV in me. She stuck me like 3 times, but I was trying to stay still, but I was shaking with pain. I was in a bad place. You think you've had to pee before? No, I had to pee I've never had to pee like that before. So they tried 3 times to irrigate it, and they said they were asking each other, like, you got any ideas? And the only thing they could think is, well, they've got to pull this catheter out, and they've got to recatheterize me. And that's not pleasant. In fact, I had never had that done before, because I was under general anesthesia when they put this catheter in. But whatever, I was in so much pain. Whatever, just do whatever. So they deflated the balloon. You just pull. I think you pull a little plug on the catheter, and it deflates this little tiny balloon. And then they can pull the catheter out. And I wasn't watching, because I didn't want to see it. My poor wife was watching. I can only imagine what she saw. But they deflated the balloon, and they pulled the catheter out. And I don't think I was draining at all at that point. I don't think I peed. Just maybe a little bit. So they immediately put a new catheter in. And I was staring at the ceiling. But my wife said, "Is that going to hurt?" And the nurse didn't say anything, but the nurse just looked at her and gave her a look like, "Yeah, it's going to hurt." So the nurse told me, "Well, you're going to feel some pressure, and whatever, just get it over with. I'm already in pain." So she started inserting this catheter, and I was like, "Pressure? That's not pressure." It hurt. But it wasn't, it wasn't as bad as the pain I was already going through. So once they got the new catheter in, I immediately started draining, and I almost immediately felt a lot better once the volume of fluid in me started getting reduced. And that the insert in the catheter, that only hurts for a few seconds. It's just a few seconds of discomfort. And I think it probably only hurt me because my urethra was torn up from the biopsy. So not tore up, but it was sensitive. Otherwise, I don't think it would be like intolerable pain. Otherwise, so once they got me drained, then my urine was still very bloody, and the doctor said to continue irrigating until the fluid was clear. So until the fluid that they were injecting came back out just the way it went in, clear. So I wasn't bleeding anymore. And they irrigated for, I don't know, maybe 20 minutes. It was a lot. And they just couldn't get it clear. So they gave up. By the way, that irrigation, it's an unfamiliar sensation. It's kind of like peeing in reverse. You can tell your bladder's getting fuller, but it's not. I wouldn't even say it's unpleasant. It's just weird. So don't be worried about irrigation. Take it from me. It's definitely better to do it than not do it. And it's easy to do. So The nurses actually showed my wife how to do it, and they had her do it. And then they sent me home with a basin and a syringe and what was left of the bottle of saline, so that if this happened again, that we could do it ourselves. Unfortunately, there wasn't much saline left in the bottle, so we only had enough to do like maybe 2 irrigations. So after that experience, I started tracking how much urine I was passing. So, you know, I know that if I maintain kind of a constant intake of water, that I should have a fairly constant output of urine. It's definitely not 1 for 1. Like if you drink 100 milliliters, you're not going to pee 100 milliliters because your body absorbs a lot of it. But if you drink something, then you should see some urine come out. So about every 2 hours, I would check. The bag has graduations of milliliters on it, so you can tell how much is in the bag. About every 2 hours, I would check how much urine was in the bag, and I'd record it. And I know, you know, I keep kind of a mental idea of how much I drank during that time period to know how much to expect. To tell if I was draining, to tell if the catheter was clogged. Because I didn't want to get to the point where I was distended again. You don't want to get to the point where you know you're clogged because you have to pee. That's too late. You want to find out before. So I was tracking my urine output about every 2 hours, maybe about every 4 hours at night, and I also used that log to record when I had taken my antibiotics, because I had to take them twice a day. Because by that time, you know, my days and nights were kind of running together because I was waking up a lot, either to check my urine or to just waking up because I was uncomfortable sleeping in this chair, or just because I was nervous. So the days and nights were kind of running together, and it's a good thing I started recording when I took the antibiotic, because there were lots of times that I wouldn't have remembered. So at one point, so we had to irrigate maybe 2 more times in the next 2 days, and then we ran out of saline. I was scheduled to get my catheter removed the day after we ran out of saline. So my biopsy was on Thursday. I went to the ER on Friday because I was clogged, and then we got through Saturday and Sunday with the little saline that we had left from the ER. And then we ran out, so we tried to get some more saline. Saline is just salt water. The saline they gave me, I think, was 0.9% by volume of salt. So it's just salt water. So I thought, well, I sent my wife to the pharmacy, and we'll go get some more saline for me. And they didn't have it. So she talked to the pharmacist, and the pharmacist said, well, we have it, but you need a prescription for it. And she said that, in fact, lots of pharmacies don't have it. You have to go to a medical supply store. And even then, you need a prescription for it. So we couldn't, and this was Sunday, so we couldn't get a prescription. And even if we did get a prescription, the medical supply store in town wasn't open to sell it to us. So one of the pharmacists, I called around everywhere, and one of the 24-hour pharmacies in town said that, yeah, we've got saline solution like that. It's in small bottles, and it's pretty expensive, but we have it. So my wife went to get that, and she came home with wound care spray. So the kind of saline that you would spray on a wound. And saline is saline as long as it has the right mixture. So even though it was in a spray bottle, I could just open the bottle and pour it into the syringe or whatever. But before I did that, I looked at the ingredients because I don't want to inject something into my body if I don't know what's in it. And there was a lot of other stuff because it was meant for kind of topical care, or into open wounds. I think there were maybe some kind of pain reliever in it, and they didn't really say that on the bottle. But if you look at the ingredients, there was other stuff in there, and I was not about to put that into my bladder. So at that point, I'm talking about this because I had noticed that I wasn't draining anymore. So I was recording every 2 hours, and I saw that this was Sunday night. I saw that my urine level wasn't increasing, even though I was drinking fluids, and I wasn't in any pain at that point. I wasn't even uncomfortable at that point. I just noticed that I wasn't draining, no matter how much I drank. So we needed to do something, and we were hoping that saline would have worked, but it didn't. It wasn't going to work. I wasn't going to use it. So we had to go to the ER again. This time was a bit more organized. I put on some pajama pants, and we cut a little hole in the pants to fit my catheter tube through, so I could at least get myself clothed before I went to the ER, even though I was still carrying a bag full of what looks like blood, even though it was urine. I still look kind of weird. So we drove to the ER, and by the time we got there, I started draining again. But we were already there, and at least they could give me a prescription or give me some saline while I was there. So they took me back to an exam room, and they used a bladder scanner. I hadn't heard of that before, but it's almost like a ultrasound. That's what it looks like, at least. They put jelly on your belly, and they kind of rub this machine against it, and the machine tells them how many milliliters of fluid are in your bladder. And I had 0, so at that point I was retaining no fluid in my bladder, which is great. That's how I'm supposed to be when I have a catheter. So they didn't irrigate me because I, at that point, didn't need it. But they sent me home with 2 big bottles of saline that I could use to irrigate if I had a problem later. And it was a good thing because this was Sunday night, and I was scheduled to get my catheter out on Monday, but I think we used half a bottle of saline. I think it's 1,000 milliliters, and each syringe we used was 60 milliliters, and we used like a half a bottle just that night, because my catheter was clogging with blood clots. So that was rough, but it could have been avoided if my nurses at the surgery center had told me that I have to irrigate, that there could be a problem with blood clots, and I should pay attention to how much urine is in my bag, and if I stop draining, that I need to irrigate. I wasn't even aware of that. That would have saved a lot of problems. So aside from blood clots clogging the catheter, I also had a few more issues. The first of which was pooping. So So, aside from when my catheter got clogged and I was really distended, I never really had any pain. Like they gave me that the hydrocodone, and I think I took it twice. Once when I first got home because I just thought I might need it, and turns out I didn't. And then once when my bladder started getting really distended, and I was hoping that would cut down on the pain, and it didn't. So I was kind of purposely refraining from taking that narcotic because it causes constipation, and I didn't want to be constipated, because straining to poop can cause a little bit of issue with the catheter. When you strain, it might cause fluid to come out around the catheter, because you lose the kind of the seal that the balloon makes against your bladder, and it lets some fluid come out. So I think in most people that would just be urine, but in my case I was bleeding so profusely in my bladder that I had blood clots that would come out around the catheter, like dark, almost black, thick blood clots that would come out when I tried to poop. So I think I tried twice, unsuccessfully, just because I freaked out, because the first time I saw blood clots come out and I freaked out and I stopped. The second time I could feel something was happening and I was about maybe to get blood clots coming out again, and I stopped because I freaked out. So even without taking my painkillers, and I was eating, and even with eating a pretty good diet, with some high fiber stuff, it was 4 days before I pooped. It was my biopsy was on Thursday, and it was Sunday. So I was kind of uncomfortable. So I should have been taking stool softeners this whole time, but I didn't. I don't know why. I should have. I did take milk of magnesia one time, to try to help get things flowing and maybe make it easier, so I wouldn't have to strain at all, and then it would just be smoother. And that didn't work on me. That just made me uncomfortable and gassy. So I did finally take a stool softener. I took a Dulcolax, and I took my iPad into the bathroom and played some YouTube videos, because obviously I like YouTube, to distract me and get my mind off things. And the best thing I did was was covering my penis with a big piece of toilet paper, honestly, just so I couldn't see it, because I knew that there were going to be some things going on there, and if I saw it, it would freak me out. So I just covered it up, and I watched some YouTube videos, and I kind of just let things happen. Took a while, but I did have success, and I felt a lot better afterwards. So even a simple thing like pooping was kind of an ordeal, unfortunately. It probably would have been solved if I had taken my stool softeners like I should have. The doctors really didn't tell me to. I just kind of knew that I was supposed to, and I didn't for some reason. I don't know why. I should have. So after you have this done, if you do have, so some people don't have a catheter after the procedure, but if you do, take some stool softeners. It makes it easier. So I had these blood clots coming out around my catheter, and I'm not sure if that's normal or not, but I had it. And that caused some issues. So the catheter itself is rarely uncomfortable. It's unpleasant to look at, you know. But it's not very uncomfortable. Normally, you can't even tell it's in normally. However, if there is blood clotting around the entrance of the catheter, like on the tip of the penis, then that gets really uncomfortable because the clots adhere to the skin and they adhere to the catheter, and then you've got anytime you move, the catheter pulls on your skin, and it's very uncomfortable. So it took me it took me about it took me a couple days to even realize that I had clotting around the catheter, because I just didn't want to look at it too much, you know. But when I finally did, I saw this black junk all the way around it, and it took me a while to realize that I needed to clean that off. I needed to get those clots off. And they weren't easy to get off because they were already solid. So I first I tried, I got some alcohol prep pads to use during irrigation. So I tried those just because they were handy and I knew they were, you know, sterile. So I tried kind of wiping the clots off with those alcohol prep pads, and that didn't work so well. So then I got some paper towels and I soaked them in hot water, and I just kind of wrapped myself with those paper towels to try to get some moisture into the clots and heat them up a bit and make them easier to get off, and that worked pretty well. I'm not sure if that's a good idea. I'm not sure if tap water is, you know, what you're supposed to use for that, but it worked. If you can't already tell, I wasn't given a lot of information about the catheter, so I don't know what the proper way to clean it is, or at least I didn't know what the proper way to clean it was. But once I got the clots off, and I kind of had to peel them off sometimes, and that was kind of uncomfortable, but it was better than the alternative. Once I got those clots off, everything was a lot more comfortable. I was afraid to move at some point because anytime I moved, it hurt. But after I got the clots off, it was, you know, no big deal. So I've since learned that you're supposed to apply bacitracin around the entrance of the catheter. Men are supposed to apply bacitracin around the entrance of the catheter, so that number one, cuts down on bacteria, and number two, acts as kind of a lubricant. So I think I would have been a lot better off if I had known that and if I had done that. And that lubrication might have helped with the other problem I had, which was erections. So it took a few days before you know, my penis kind of woke up, and I started getting erections again at night. But when it did happen, it was pretty painful, and it would wake me up from a sleep. So I wanted to get rid of, you know, the erection. And I found that if I flexed my calf muscles, I was laying in a lazy boy, but if I flexed my calf muscles as I was sitting for a while and held it, that would help get rid of the erection. And I've since read that if you're sitting, well, so what you want to do is flex a large muscle, and that draws blood to that muscle, I think. So some of your largest muscles are your thigh muscles. So if you're sitting, you can push your feet against the floor like you're about to stand up, and that flexes your thigh muscles and kind of just hold it. And I found that the erection would go away within about 30 seconds if I was flexing some big muscles. So that woke me up a lot at night. Probably would have been better if I had been using, well, number one, if I had cleaned all the clots away at that point, and number two, if I had been lubricating with bacitracin. That would have helped a lot. So 4 days after the TURB, after the biopsy, I was scheduled to get the catheter removed. I think I think that 4 days is longer than normal, but my procedure was on a Thursday, so the next good time to get it taken out was Monday. So 4 days later, I got back in the urologist's office. They pull the catheter out there, and it's really quick. So what they did first was to fill my bladder with as much fluid as I could take. So they hook up a container of saline to the catheter, and they hold it up above you so that the gravity forces the fluid into you, and they fill you up. The nurse said to tell her when, so pretend that I was standing in line somewhere in a long line, and to tell her when my bladder got full enough that if I were standing in line, I'd get out of line to go pee. So not to like the threshold of pain or anything, but just when you're uncomfortable enough to get out of line. So for me, that was about, at the time, that was about 350 milliliters. So once I got to that point, I said stop, and she disconnected me and then deflated the balloon, and just pulled the whole thing out. It was mildly uncomfortable. Mostly I was just afraid that I was going to spew pee everywhere, because I didn't know how much control I would have once they pulled the catheter out, because it had been in for 4 days, right? So I didn't know if the muscles would be able to work at that point. But I didn't spew pee anywhere. So she handed me well, she was ready if I did. Like, she had this little container and she kind of aimed me into it as she was pulling the catheter out, and then I didn't pee, so she handed it to me, and then I sat up, and she left the room, and I just peed like I normally would into this container. I guess it wasn't exactly like I normally would, because one of the most surprising things at that point was I actually started peeing air. So, like, that was weird. It didn't hurt. It was just really weird. Kind of like a sputtering hose, I guess. So that was an odd sensation. But that cleared up within, a few seconds. And then I was just peeing. So I peed all 350 milliliters back out, which is exactly what they want to see. So I was able to void on my own. So I think the air was probably caused by all the irrigations that we had to do, and maybe caused by putting the second catheter in. But anyway, so you might not have that experience. But if you do, it's not. It's just weird. It doesn't hurt. And removing the catheter didn't hurt either. It was just uncomfortable. So the nurse came back in, measured me, and reported that I peed all 350 milliliters back out. So they they let me go, and they told me to avoid the 4 C's of bladder irritation. So I had to limit my diet to avoid irritating my bladder. These 4 C's are caffeine, carbonation, citrus, and chocolate. So I think the chocolate part is because it contains caffeine. So caffeine, carbonation, citrus, chocolate, which sucked because I like coffee, and I couldn't have it. It's kind of an addiction that I'm happy to have. The good news is I've broken myself of caffeine addiction now, but the bad news is I miss it. Anyway, and I tried decaf coffee a couple times, but it caused, at the time at least, it caused some burning when I urinated, extra burning. So I just didn't think it was worth it at the time. So after I got home, after having the catheter removed, I didn't have any serious issues. There was some burning during urination, and it took about a month for my urine to clear up. So it's only been recently that my urine has stopped having blood in it. And I've honestly still got some burning during urination. And towards the end of my urine clearing up, I passed some pretty big blood clots. And passing, it was fairly normal for me to pass small clots occasionally. But at the end, man, I passed a really big one. I didn't know it could be that big, and it didn't hurt. I barely even felt it when it came out. But I was super surprised that I could pass something that big without it hurting. I actually fished it out of the toilet with some chopsticks, just to get a picture of it. But after I did that, then the blood cleared up, and now my urine's back to normal. So about a month before my urine went back to normal again. And I've personally still got some burning that I haven't really pressed for a diagnosis on that. My urologist did take some urine and do a culture on it to see if there was bacteria. I didn't hear back from him, but so I assume that answer is no. But I'm not too worried about the burning because I'm going in for a second procedure very soon anyway, and they'll check me out and put me on antibiotics then to clear up whatever the problem is. So I think that amount of recovery time, for me, a month before the blood went away, and still having burning, I think that's really long. I don't think most people who have a TURB biopsy done on them will have that kind of recovery time. And I think if you even have a catheter afterwards, some people have it removed immediately after the procedure, after they're done irrigating the bladder and everything. I think if you even have a catheter, that yours probably won't be in for as long as mine, and if you know how to irrigate it, that you won't have any problems. You'll just need to track your output and irrigate. And I think my long recovery time is probably due to how distended my bladder got, and also inserting the second catheter. So I think a lot of these issues could have been avoided. It was really unpleasant for me because I didn't know all this stuff and I wasn't taught all this stuff. So this was a rough episode. Let's get it over with and talk about the lessons learned, because that's the most important part. So first off, don't have an indwelling catheter without having the supplies and the knowledge to irrigate it. And when you have a catheter and you are peeing some blood, or you see some blood clots, you need to ensure that you're draining. So my advice is to track your output and make sure that it's getting, it's growing, that you keep peeing. Make sure that you keep peeing. If you stop peeing when you should be peeing, if you drank and you're not draining, then go to the ER. If you're not able to irrigate yourself, or if you attempt to irrigate, my doctor said twice. If you inject 2 syringes and it's not helping, then go to the ER. I know if you're like me, you don't want to go to the ER and you feel self-conscious going to the ER, because the ER is a big deal. At least it is for me. But no, go to the ER, because it's not going to get any better, and it hurts if it doesn't, and it causes other complications. So know how to irrigate, track, irrigate, and go to the ER if you can't get it done. Also, you need to clean around the catheter entrance to clear any clotting that you might have. And males should use bacitration around the entrance to disinfect and lubricate. And if you've got a catheter, and man, especially if you're taking narcotics, take stool softeners. So take some Dulcolax, and don't scare yourself into not pooping. I did. I was terrified. You gotta poop, man. You gotta poop. So take your stool softeners, and it helped me to cover everything up, so I just couldn't see it, and distract myself with something, and just kind of let it happen, So I think all of those things would have avoided a lot of trouble.